Which drugs are FDA approved for bispecific therapy and how do they work?
There are two bispecifics that have been approved by FDA for treating patients with diffuse large B-cell lymphoma. The indication is a third-line setting, meaning that for both, patients had received classical chemoimmunotherapy and a second line of treatment, which could be again chemoimmunotherapy, another form of immunotherapy or targeted agents, or CAR T cells. So patients who have failed two lines of therapy. One of those is called glofitamab, the other one is called epcoritamab. There are similarities, is that both engage CD20 and CD3, so it's the same process that is the active process of this bispecific. There are, however, several differences. One of the differences is that glofitamab is an IV drug, which is an infusion, administered as an infusion, whereas epcoritamab is a subcutaneous drug administered as a shot. The second difference in when they were developed, the schedule of administration is different, with for both drugs weekly administration during the first months, but then after the administration are spread with longer interval with glofitamab as compared to epcoritamab. And the third difference is that glofitamab was developed as treatment that is finite in time and is administered for 12 cycles, 8 months, while epcoritamab was developed with indefinite treatment as long as the patient benefits for the treatment, responds to treatment, or does not have to interrupt for side effects. So drugs that are very similar in their mode of action, actually very similar in their efficacy, but different in the constraints for patient, the side effects, the schedule of administration, one time-limited treatment, one treatment with indefinite until progression.